Let's stand and do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So I think everyone should have looked at the previous meeting's minutes. Are there any suggestions, additions, et cetera? Or can I have a motion to approve them?
Approved.
And a second? You have to. Yeah.
Second.
All in favor? Aye.
Aye.
Any opposed? Aye. Okay, terrific. Health Officers Report, Larry Taltone.
Good afternoon to the board and to the audience who are attending tonight. You have my report, and I think what I'll do is leave it stand as submitted. If any questions, I'll be happy to answer them. I would like to take the opportunity to, while I have the microphone, to certainly wish Ms. Wishner, Dr. Donato, and Dr. Salvador my thanks for being on the Board of Health and helping me. They've all been great and all benefited this board and this community. And I'll continue to worry you. I would like to remind people of the flu shots, the rabies vaccine for their pets, dogs and cats. Even those pets that are house cats, they should get their shots. We again, I want to remind you of the March the 18th of 2015. The Workplace Safety Committee of Radnor Township will be having a health and safety fair. And my colleague that's sitting next to me tonight, Mrs. Megan Sullivan, will be talking more about the manager's challenge that's going to be associated with that. Madam Chairman, so ends my report.
Thank you very much. I want to sort of juggle the agenda a little bit because of the number of speakers that we have. So I think if Judy, do you want to go first? So let me introduce Judy Mateski. She's a registered dietitian and an LDN nutrition program specialist in community health services from Bryn Mawr Hospital and Paoli Hospital. And she's going to talk to us a bit about what she does and resources available for the community.
Great. Thank you. Well, thank you so much for inviting me this evening. It's nice to be here. I'm happy to just talk a little bit about some of the nutrition programs that we have at Mainline Health. We certainly are very concerned about the rise of obesity across the country, and we're certainly not immune, in our neck of the woods. And although we are below the average as far as obesity, we are certainly trending up compared to the state. One thing that's interesting, if you look at the community health needs assessment, is that we find that only about 20% of adults and children actually meet the 5 or more servings of fruits and vegetables every day. So we have a lot of work to do to improve nutrition sort of across the board. But I really wanted to talk a little bit about some of the nutrition programs that we have at Mainline Health. And first and foremost, I just wanted to mention that when you certainly log into Mainline Health, we do have a wonderful website. It's the Well Ahead community resource. And you can follow us Facebook, Twitter, all the technologies. The Mainline Health we have an app. But logging into the Well Ahead resources, you can find a listing of all the events that are happening across all of the hospitals. There's a lot of resources on different articles related to health, nutrition, certainly across the board on all types of things, including recipes. So wanted to put that out there because that's a really nice community resource, and it's available to everybody and very easy to access. We have a nutrition center at Mainline Health at all of the hospitals, so we do have registered and licensed dietitians available for to offer to offer nutrition services for counseling at all of the hospitals. So there are outpatient dietitians available. We have them at Bryn Mawr, Paoli, Riddle. We're also out at the Exton Square, Mainline Health Center in Exton Square, as well as at Lankenau. And it's not, for someone to access their services, you do not need a referral from your physician. You can call the center directly and schedule that appointment. And they see adults as well as children. So it's a nice resource. We certainly have the bariatric surgery program at Bryn Mawr, which has ongoing orientation programs. There are several offered every month, and those again, the times and dates can be found on the Mainline Health website. As far as there's a very brand new medical weight management program that we are just launching. The information sessions will be, the first one really will be January the 8th, and it's new to Mainline Health. It will be, the orientation center session will be out at the Mainline Health Center in Exton Square. It will be an interesting program. It's new for us. It's a very comprehensive medically supervised weight management program that includes meal replacements, but also followed with physicians and dietitians and exercise specialists along the way. So that's new to our community outreach. As far as community health services, which is the department that I work in, we do a lot of outreach education around nutrition. We have registered dietitians that are available to go into any kind of community setting, to work with companies, certainly any schools. We have a couple of school-based programs that we bring to the schools for 2nd and 4th grade, but we can certainly go into any grade level, as well as a lot of very interactive health fair booths that are centered around a lot of different health topics, but we have many that are connected with nutrition. I actually work as a dietitian within Community Health Services, but I also work for Bryn Mawr Family Practice. So I work with the physicians in the practice and do a lot of weight management within the practice itself. And this is a model that we're really looking at to take this out to other primary care settings so that we'll actually have a dietitian within the practice for that referral. I also, Amy just mentioned that maybe we could talk real briefly about 4 tips for the holidays to stay healthy. So I'm going to end with that. I did bring a lot of brochures on the Nutrition Center, the bariatric program, community health services, all sorts of things. So if anybody wanted, I'll leave those here, so in case you'd want more information, all of that. 4 things you can do to stay healthy through the holidays when it comes to nutrition and weight. My first thing is just be as active as you possibly can. I tell everybody to try to at least be active for 30 minutes a day. It gets tougher around the holidays, so 30 minutes might be challenging. There's a new app, it's called the 7-Minute Workout, just came out not that long ago, and now there's an upgraded version, so if you've tried it and have advanced, maybe go on to the more advanced level of the 7-minute workout, but I think all of us can find 7 minutes to work out. I also talk a lot about doing 10-minute exercise snacks. So maybe instead of thinking about it in small little time frames, so maybe there's 10 minutes before or after lunch, and it can be sort of a snack of exercise that you can get in. But that's top and foremost, I think, for holiday eating tips. If you're at a buffet, take the smallest plate you can find, make half of it filled with vegetables. Do that first so you can fill up with vegetables and then move on to some of the other things. And when you're really scanning your buffet, or if you're at a party, be very mindful and take a little bit of time and see what's on the buffet, and then select those things that you only get once or twice a year and skip the rest. I always tell everybody to think about a serving size for something that's rich when it comes to a dessert or a very rich entree is really about the size of an egg. So if you want something that's really rich, by all means have it and enjoy it, but think about that portion and keep it as small as possible. And the last recommendation would be, how about thinking about drinking water? 16 ounces of water before the party, during the party, and after the party. Particularly that in itself before the party that'll help fill you off and sort of offset that hunger a little bit before you get there. So those are some healthy holiday tips that, trying to maintain a healthy weight through the holidays, but also enjoying them as well without, feeling too deprived. Does anybody have any questions about anything of any of the programs that we offer?
Well, I just wanted to comment. I went to one of the Well Ahead activities that was at Lankenau Hospital. I think it was just in November. It was focused on women's cardiac health. And it was excellent. I mean, there was various healthy foods when you got there. And then there was a terrific panel of people, that included, wellness tips around a whole range of issues, all of which kind of add up to cardiac health, and as well as then specific workshops you could go to. And it just was, the whole thing was very well run. All the speakers were excellent. It really helped showcase the different resources that Mainline Health has, and sort of this focus on women's health. So I'm sure all the other events are of equally high caliber. So I would just put in a plug for them. And
Yeah,
it was
that's
just
excellent.
a terrific, and it was free and to the
It's an
community.
excellent
and-
program. Yeah, and again, if you're, looking at those events, they're all available on the website with a listing. And we have several newsletters. We have a Well Ahead newsletter as well as a Women's Health Source newsletter, and those are really wonderful. You can just put your email in, and you can get on that mailing list, because you'll find a lot of great articles, but also all of the events that are occurring. So you'll know them when they're coming up. Thank you.
Thank you very much. Megan Sullivan, do you want to talk about the Manager's Challenge from the Department of Parks and Rec?
Hi, everybody. My name is Megan Sullivan. I'm the program supervisor for the Recreation and Community Programming Department. I come to you on behalf of the Township Manager, Mr. Robert Zinkowski. He and I are teaming up to do the Manager's Challenge. We did it 2 years ago with just the employees. So this year we're gearing up to not only focus on our staff. We always want to make sure that they're healthy, taking care of themselves. That way, they're coming to work Monday through Friday, not taking 6 days, as I kind of have a cough right now, so I'm pushing through it. But we're also reaching out to the community, the commissioners, all the different wards to participate as well. So I just wanted to kind of tell you about it. So we're gearing up to start in February, since that's Heart Month. So we figured that'd be a great time to start. So what we're doing is we're giving the employees as well as the people in the township the opportunity to challenge themselves with a goal, whether it be weight loss, quit smoking, or just to get active. I mean, you don't have to necessarily see any weight loss or something like that, just being active. Judy kind of mentioned that in her discussion with you. So those are the three goals that we're having our employees as well as the residents set for themselves. So there's a registration form that's in our activity guide, and it's on our website. So people will have the opportunity between now and February 7th to set a goal. After the new year comes, after the holidays and everything, everyone starts talking about losing weight and everything. So this kind of gets the ball rolling with that. They'll present it to myself and the township manager. Our employees will have the opportunity to get a vacation day. The township manager is going to donate one of his to the top 3 employees. So that's another incentive for them to get out and get active. Now, how do the residents benefit from it? The township manager is working with a lot of his connections, his sponsors that he works at throughout the year to get really nice prizes like TVs donated and things like that. So trying to get the residents involved as much as possible. So we'll have some top prizes and everything for them to kind of participate. We'd like to have a lunch for them as well to kind of thank them for participating, a healthy lunch, and kind of say, you know what, you did it, you met your goal, which is great. So that program is starting, like I said, February 14th and then running through May 9th. So it's a 12-week program. We'll be there for support. We'll do health and wellness seminars with the Wayne Arts Center. We're still working on those, as well as working with the local fitness areas to kind of see what we have in the area, because we actually have a lot of fitness places here. So we're going to be able to provide the residents and the employees with information about how to go and do a free trial. Most gyms all do a 3-day or a week trial. So we'll be there for support with them, giving them information about those healthy classes at the Wayne Arts Center. And then we're also doing, like Larry mentioned, our health and safety fair. I'm the secretary on the safety committee, so we're coordinating that with this program. So it'll be here at the Township Building Wednesday, March 18th, 10 to 2. So it's also for employees, but it's also for the residents and anybody that wants to come in, get tested, get their heart, their blood pressure, things like that. So it'll actually be here in this room. We'll have light refreshments, some door prizes and things like that. So to get the community to come out, participate, as well as our staff here since they're in the building. So the township manager and I, we want to get healthy. He wants to get healthy. He said, this is perfect. I'll do the challenge as well, get our residents healthy, which is a big thing because in my department, we always do so much for our residents. So we want them to live long and be healthy. So that is basically my information for you guys. I know Larry has my contact information if any of you are interested in, partnering with us, giving us ideas, suggestions for how we can better improve the program, make it, achievable for our employees and the residents to participate and meet those goals. I do not have a nutrition background, but I'm also going to be able to do it and try to meet a goal, whether it's weight loss or actually get, more healthy afterwards. So any suggestions that you guys have, you're the experts, you have the background, you have the resources, please feel free to reach out to me or the township manager with any suggestions that you have or feedback of what we could do to kind of make this program great for this year and then last for a few more years. All right. Thank you.
So can you just repeat, Megan, so if people, such as myself, would like to enroll in this and, establish a goal, can you just repeat where one would go
sure.
to do that?
We have the registration form in our activity guide, which is on our website. So if you click the Winter Spring Activity Guide, and I believe it's page 4 or 5 of that guide, there's a form fill form, which will allow you to put all your information in there, your contact information, set those goals, and also we have a part in there where it says, how am I going to measure it? Now, if you are going to do weight loss and you want to lose, 10 pounds by the end of the program, how is that going to be measured? Every 2 weeks, every month, you're going to weigh yourself just to kind of keep yourself on point. So those registration forms are accessible via the website. And then the deadline to submit those is February 7th to either my office or the township manager. We'll keep those on file. We'll greet you and welcome you into the program, and then continue to give you updates on all the programs that we're doing, all the free workshops. We just want to make sure everybody can attend, so we have sponsorship money that will cover the cost of all the instructors and all the lectures that we'll do. Cool. Anything else?
Terrific.
Great, thank you.
Thank you very much. I wondered, Dr. Foreman, did you have a chance to meet with the business group? Can you report on that?
So I did attend the Wayne Business Association meeting with President Schaefer from the board was also there. This was in November at their meeting at Eastern College. It was a good experience in general all around, but I did get to speak with some of the business owners in the Wayne community about their thoughts on making the sidewalks of Wayne business area smoke-free. There was not a lot of restaurant owners there. There was mostly some of the smaller businesses along Route 30 there who I spoke with, and they were very interested in the idea of making it smoke-free for both littering reasons and also for for the air and making it cleaner. I did after that go to some businesses in Wayne and drop off a letter that I just wrote from the board that basically said we're looking into the possibility of making the outside, or recommending to make the outside of Wayne smoke-free, and wanted to get their thoughts on it. So I think in the next month or so, I'm hoping to get back in touch with some of the restaurant owners that have outdoor seating in Wayne and see what their thoughts would be about, if that would be something they would be interested in, or if that would be, detrimental to business on the outside, in the outside areas. But it was a very great meeting, and I think a great resource for us as well. It's to mention about health in the community. Eastern University is just a beautiful campus, and they're very welcoming to people to come and use their facility as walking trails and beautiful facilities they have, and it's just a great resource to have locally. So I think I'm hoping to attend the next Wayne business meeting as well, or maybe in January to speak with more of the business owners in Wayne and discuss this further.
Is Christopher still the president of the Wayne Business Association?
I think he's vice president.
Because he would be a good person to one-on-one contact, because all the restaurant people, they go to him, because he's very supportive of new restaurants, et cetera.
Waiting for him there. He was not there that day.
Of course.
But it was,
Okay.
good experience.
Well, maybe we should go to Christopher's after the meeting.
Thank you. Further thoughts about that? Thank you for doing that, and it does sound like a good, process. So, yeah. And as you're saying, probably a good resource for the Board of Health to keep in mind about a variety of health issues as well. Yeah, thank you. Okay, great. Mainline Health. There have been various rumors floating around about what's happening, why it's happening, what's not happening, et cetera, et cetera. So I thought, well, let's start by having people from Mainline Health come and tell us about what is happening and when it's happening and why it's happening, so that we can start from having the facts. So I'll turn it over to you. If you could introduce yourself.
I'll do that.
Thank you.
Very much. Thanks, Meg. I'm Andy Gilbert. I'm the president of Bryn Mawr Hospital, and I'm happy to be here tonight and sort of bring you up to date on a number of things that are happening, really two pieces of, we think, important and exciting information that we wanted to be able to discuss and share. The first is that on just about a week and a half ago, on December 4th, the Mainline Health Board of Trustees approved a $200 million investment in Bryn Mawr Hospital. This is a project basically to modernize the hospital. It has been long in the planning stages and discussion phases, and we are early in the process of reviewing the project. Although it's approved by the zoning requirements of Lower Merion, the planning process and the land development process will begin in front of us over the next year. Our plan is to break ground in 2016. Again, this is really historic development for the hospital, having been here for 120 years. This is the largest single one-time undertaking in the facility requirements. And as we talk about it, this is a must-do project, and we are very excited about undertaking it. The highlights of the project include being able to, at the end of this project, to provide all private rooms for patients, something that we would like to do but can't do in all circumstances today. We will be replacing all of our ORs. So that's a major project that will happen probably in the new part of the pavilion. We're going to be creating a new patient pavilion in the center of the campus. We will also be creating a new intensive care unit, so new critical care capabilities. The whole project will be over 200,000 square feet of new space, and then investments in renovating some of the existing programs in the remaining hospital. So the project timeline is roughly groundbreaking in 2016, the middle of 2016, and it's essentially a 2-year construction project. So we hope to be able to operate the new facilities by the end of 2018. Obviously, a lot of that depends on this development process, but we think, and having had a lot of extensive conversations with Lower Merion, this is certainly not a surprise project to them. And again, I think they and we are truly thrilled to be at this juncture. So lots of details. We will obviously be sharing milestones and more of a public announcement of this when we are further along in the project, but obviously wanted this board to be aware of that important piece of information. Any questions on that at all? Okay. The other discussion that I wanted to share tonight was one that we've had with the Radnor Board of Health in the past, and it's about some important decisions that we have made relative to cardiac surgery. That's the open heart surgical program that is at Bryn Mawr Hospital. As you know, we have been contemplating changes to the program, specifically the open heart surgical piece of our extensive cardiovascular program. For many years, actually, we've been in conversations over the last 18 months, but frankly, it's been a conversation in the Mainline Health system for well over a decade. One of our primary considerations is the known benefit to patients of operating high-volume centers for this type of surgery. CT surgery is declining nationally, as other less invasive options for care, for cardiac care, have become the norm. And I think most of you know that cardiac catheterization has replaced much of the need for bypass surgery, but it remains a need, and clearly we are prepared to address that need, as I will discuss. We believe it is in the best interests of our patients to consolidate the scheduled open heart surgery surgical work at the hospital with those currently offered at our sister facility at Lankenau Medical Center. Open heart surgery is most commonly a scheduled surgical procedure. While important and urgent, it is a scheduled event. However, for the highly unusual instances that emergency open heart surgery is needed at Bryn Mawr Hospital, we will mobilize a specialized cardiothoracic surgical team from Lankenau, and the implementation work, the work groups that are reviewing this plan, including cardiologists and other physicians from across our health system, are currently in the process of finalizing that plan. So again, we haven't implemented this plan, but we are now prepared to do so in the interest, and we believe, of our community. We are also discussing, while we're discussing emergencies, I think it's important to note that the most common emergency cardiovascular condition is a heart attack. And the standard of care for treating heart attacks is to insert stents into blocked arteries around the heart. This is done in a cardiac catheterization lab. Bryn Mawr has a very busy, high-volume cardiac catheterization service. In fact, we run 3 of these labs, and they will continue to operate in a very robust way. It may be also helpful to know that there are analogous clinical arrangements across our health system. For example, inpatient pediatric care is handled at Bryn Mawr Hospital and not at the other facilities, again, because of volume. And more recently, interventional stroke care, a very sophisticated, high-tech service that we partner with Jefferson University on, is a very sophisticated interventional service that we only provide at Bryn Mawr and not at the other hospitals. Again, consolidating services where volume, where we want to make sure there is enough volume to do it well, provide a high standard of care, and that is really a driver. We firmly believe that the decision on cardiac care, cardiothoracic surgery, is best for our patients and takes advantage of the clinical strengths across our health system, and really leverages the expertise across our system and enables us to provide a high standard. We have seen that from outcomes across the health system and our colleagues across the country. Again, we're taking our cues from the work across the industry, and highly specialized programs like cardiac surgery, which again, where best outcomes are done in high-volume centers. We've seen this recently, most recently, at Georgetown University Hospital in Washington, D.C., and its sister hospital, the Washington Hospital Center. It is a decision that the Allegiant Health System in Nebraska has made, as well as the John Muir Health Center in Northern California. The data supports that when geographically possible, transferring scheduled heart surgery to one location is a best practice, ultimately delivering superior results for patients while supporting the financial well-being of the organization. I think it's really important to know that in making this decision, that we want to make very clear that the cardiology and cardiovascular program at Bryn Mawr Hospital is robust and remains very active. We have, on balance, over 15 cardiologists, including clinical interventional cardiologists, who will remain at the Bryn Mawr Hospital campus doing the work that I think most of us are very accustomed to and know and do exceedingly well. And again, I want to make sure that in this conversation that is not lost, and that that commitment and that need for the community is essential. So again, it's the emergent cardiovascular needs will still be benefited from the capabilities that will be offered across the system. We think that this change will support our goals to improve community health care by seamlessly integrating specialty and subspecialty expertise and capabilities that are available across our health system. So, as always, we remain dedicated to keeping our patients and communities at the center of our planning process and are committed to keeping all of you engaged as the process moves forward. So those are my updated remarks. I am sure you may have some questions, and I'm happy to answer them. I know my colleague, Dr. Larry Mendelson, a cardiologist at Bryn Mawr Hospital, is here, as well as Lydia Hammer, the Senior Vice President for Planning and Business Development at Mainline Health. So, questions at this point, or I can ask
I have
Dr.
one.
Mendelson.
I have a
Sure.
clarification, if you
Yeah.
don't mind. So, if someone's at Bryn Mawr Hospital and they need surgery, did I hear you say that a cardiothoracic team would come from Lankenau to Bryn Mawr, or the patient has to be transported?
So in an emergency, and I can count on one hand how many of those have occurred over the last 10 years that I've been at Bryn Mawr. In an absolute critical emergency where the patient cannot be transferred, we will mobilize a team that will come from Lankenau, the cardiovascular surgeons, because it is one surgical practice supporting for the system and the community, will come to Bryn Mawr Hospital, and that's the detailed work and planning that is going on. If a patient, and again, I think Dr. Mendelson is probably best able to discuss the clinical issues, but for the most part, if a patient is evaluated and is determined to need surgery, the surgical team from Lankenau, if the patient is an inpatient, will come to Bryn Mawr to evaluate the patient, work up the plan with the cardiologist, and then oftentimes the patient is discharged and then is scheduled for the surgery at another point in time. It could be a week, could be a month, could be whenever it's necessary to happen. If it's necessary to happen directly by transfer, the patient would be transferred directly to Lankenau, and that is how we envision the service proceeding. And the cardiologists who are involved in the care from Bryn Mawr will continue to manage that patient at Lankenau. I hope I've answered that question, and again, I can certainly have Dr. Mendelson further elaborate. And I will tell you that some of that already happens. So this is not like we're introducing a totally new scenario. We have sophisticated valve surgery that's currently happening, where patients are treated and surgically managed at Lankenau and followed by the cardiologist. So again, we're not inventing a totally new program. We're embellishing it and now formalizing it.
Thank you. My concern from the get-go, and it appears that it's the way it will be, is transferring a patient. That, to me, is a concern for our citizens. But if that is the way you plan to do it, at least you're upfront and they know that. Mm-hmm. But I still maintain their critical moments of life. So.
Well, again, I think we can certainly have the clinical staff really talk about the life-saving surgery that occurs that where time is absolutely essential and critical and must happen immediately, and those are extremely rare circumstances. As I said, I can count on one hand, and I've been at Bryn Mawr for 14 years, the number of times that has happened. And even when that happens, we still have to mobilize the team. Because the team is not sitting in the hospital 24/7, and so the heart surgeon still has to be mobilized, and the team has to come in, and so again that would happen. But in the routine cases, patients would be surgically managed at Lankenau, and again mostly they're being discharged and following up with a scheduled surgery. And again, the cardiology team, their primary physician, their cardiologist would be involved in the care, and it's the surgical team, obviously, that we want to make sure is producing and doing high volume surgery to produce the kinds of clinical outcomes that are so critical, and that's what we have our eye on. So, yes.
Andy, can you project what might happen in terms of consolidation in the area of maternity, obstetrics,
Sure, I'd be happy to, Louise.
At least
Yeah,
Lankenau and Bryn Mawr.
right.
I'm sorry, could you repeat that, because her microphone wasn't on? So if you would just repeat the question
Oh,
she
sure.
asked.
So Louise has asked, what is the current thinking about consolidation of maternity programs between Lankenau and Bryn Mawr? There is no plan to consolidate maternity programs. The volume is too high at both institutions, and both institutions have a long and excellent service and history in that area. And again, it's a question of volume. There is no one of our hospitals has a big enough facility, and although we have studied that issue over the years, we have made a very firm decision and clear decision that although 4 miles apart, programs are big enough in size to produce the kinds of outcomes, clinical outcomes, that are of high quality and will serve this community well from an outcomes perspective.
Thank you.
Yeah.
So it's well documented that combining services to well-running systems in one site, may add value and may improve outcomes, certainly in surgery. But I think the details regarding the planning for how that happens, I think the community would want to know. Mm-hmm. And I think the elective surgery seems clearer to all of us. I think the challenge becomes how we handle emergency cases, and as you said, a high-volume cath lab, which, if it's high volume, even if it's a low probability, there's going to be real lives in our community at stake. And so I think the plans for which that occurs and how that occurs logistically becomes of great importance to the Board of Health.
Yeah, no, I think that's an excellent point. And as noted, the high-volume cardiac catheterization lab and electrophysiology lab will need surgical backup. And the whole United States has confirmed that these programs can exist and have actually been approved to exist without on-site CT surgery. We will have a formal surgical backup program, particularly on the higher risk cases, and that's part of the plan.
And is it your intention to present that plan here to the Board of Health? And as a follow-up question, what system would you have once you implement that plan to monitor the outcomes of that specific subset of patients?
Yeah, we certainly can share that plan with you. And as I indicated, the physicians are working with our teams now to work out the granular details of the mobilization plan for emergency CT surgery at Bryn Mawr. And we monitor our outcomes all the time, and so we are happy through a formal process to share that. Increasingly, health systems are sharing that data, publicly. There is a statewide report that actually, I'm not sure when the last report was produced by PHC4, but they are publishing outcomes on cardiac cath and certainly CT surgery. So yeah, we will be happy to do so.
Thank you.
Sure. I don't know if Dr. Mendelson was planning to make any remarks or just be available to answer questions. I have some remarks. Sure, it might be helpful. Okay, great. And I have a copy of a letter, Meg, that outlines.
My name is Larry Mendelson. I'm a cardiologist at Bryn Mawr, and I spoke with this board maybe about 18 months ago about this topic, about CT surgery possibly leaving Bryn Mawr Hospital and what this could mean to the hospital and the community that we serve. It's a complicated decision, which is not yet final, though we're getting there. I wanted to give a cardiologist perspective on what this might mean. So it's important to know that CT surgery is really just a fraction of what I do in cardiology. I see about 20 to 25 patients a day. In the hospital, I see maybe 100 patients a week in the office. Maybe 1 or 2 of these patients are actually cardiothoracic surgical patients. What cardiology really is, what I do every day, I take care of patients with chest pain, with heart failure, with arrhythmias. It's evaluating and treating these patients. It's echocardiography, stress testing, nuclear cardiology, it's cardiac catheterizations, interventions, it's electrophysiologic evaluations and ablative therapy. It's treating acute MIs very quickly. It's triaging a patient with chest pain that's low risk, so he or she can leave the ER and get outpatient testing or follow-up. And rarely, it's a patient that needs cardiac surgery, in which case we ask our surgical colleagues to evaluate and treat. Bryn Mawr Hospital performs the highest form of cardiology. We do complex coronary interventions, complex arrhythmia therapy. We treat complicated heart failure patients. We are an accredited chest pain center. Nobody in the Philadelphia area treats acute MIs faster than us. That's the truth. Our staff is highly trained. We're multi-boarded. Should elective CT surgery moves to Lankenau Hospital, none of this has to change. This level of high-end cardiology stays and grows. However, to ensure that this is the case, we need solid administrative support to continue to provide the necessary resources. Even if elective heart surgery were to move to Lankenau, there will still need to be a solid CT surgical presence at Bryn Mawr Hospital for emergency backup and consultative purposes. This has been promised and assured by Mainline Health. You could put that in the minutes. Now, to be honest, personally and professionally, I wish CT surgery would stay at Bryn Mawr. I like taking care of these patients. I like seeing my patients after surgery. I like being involved in all aspects of their care. It's part of what I do. Losing this would be losing part of what I enjoy doing. So I sincerely hope that elective CT surgery remains a part of Bryn Mawr Hospital. But if this were to change, if we move these 60 cases per year to Lankenau Hospital, that's about all we're doing right now, the cardiology that Bryn Mawr Hospital offers to our community on a daily basis hardly changes at all. We still provide the highest level of cardiology care with the most advanced treatments. We will still see all patients, no matter the complexity, and we will continue to grow and thrive. And this is our promise to the community that we serve. Questions?
Thank you, Dr. Mendelson. So just a question, so if a patient of yours that you see in the office needs cardiac catheterization, are you going to tell the patient that they have an option to go to Lankenau for their cath where there is CT surgery backup and disclose that you have no CT surgery backup at Bryn Mawr Hospital?
Well, I'll definitely offer them the option of Lankenau, but there is CT surgery backup. So, I mean, everything I just said can't be done unless there's CT surgery backup. So there has to be CT surgery backup.
So to rephrase, so in-house CT surgery services.
I'll let them know that Lankenau exists, but just so you know how it is right now, I mean, we literally do 60 cases a year at Bryn Mawr. So that's once a week. So CT surgery is at Bryn Mawr Hospital right now, perhaps once or twice a week. And we're doing cases every day. So it probably won't be that much different. So the patients will know that should they need emergency surgery, certainly if they need elective surgery, they may be transferred to Lankenau, but they will have the option if they choose to go to Lankenau. And I will disclose to them the current plan for sure.
Great.
Okay.
Good points. Thanks for bringing those up. Thank you for coming,
Thank you.
Dr. Mendelson. Thank you for coming, Ms. Gilbert. We really appreciate your taking the time. And as you know, many people, surprisingly large number of people watch this on cable TV at one time or another. So as it is rebroadcast quite a bit. So I thank you for helping keep the community abreast of what's happening and explaining, the rationale behind it. Thank you. I wanted to see if we have a Boy Scout here, Adam, and his mom working on a merit badge, and I wondered if they would come to the microphone and just say what's involved in the merit badge is it called public health? The merit badge? If you would just come to the microphone and just say a little bit about what it is and why you're here. I think people would be interested. Adam, if you would just say your name and what troop you're with and what you're doing.
So I'm Adam, and I'm in Troop 219. I'm working on the citizenship in the community merit badge, and one of my prerequisites was to come to one of these meetings and listen to what they say and like take note, and that's pretty much it.
One of the things that Adam,
Could you just say your name, please?
Sure. I'm Adam's mom, Annette. One of the things that Adam will be doing is digesting a lot of this information and watching the rebroadcast of this so that he can gather information on community issues and knowing what he can do to help participate in those, perhaps as a volunteer, perhaps as a mouthpiece to help become an advocate in the community about some of the issues, particularly some of the issues that are focused on youth and what he can do to become more involved as a citizen here in Radnor Township.
Thank you. I mean, one of the things that is really helpful for us as a board also is to hear from people like you, and if your troop were so interested, to let us know about an issue that you think needs to be better addressed in the community, because I think a lot of times you know something or kids are involved in things that is kind of flying under the radar. And so, and yet it might be a health issue that you could really use either more scientific information about, like what's the real deal with this or that, or just that there might be some way that we could be of help or of use to you. So not only should you think about, okay, receiving sort of what's coming to you, but think about also offering, you know, your ideas about, well, gee, I wonder if you guys have done anything about this, because that would be really helpful to us. So we're all ears. We'd love to hear from you. And thanks so much for coming.
Thanks for having us.
So I'm just reminding people in your packet, there was a call for submission of abstracts for the Public Health Day Symposium, which will be April 6, 2015 in the morning at the College of Physicians in Philadelphia. If you've never been to the College of Physicians, it's an interesting place, and in the warmer weather, they have a medicinal herb garden right outside, too, which is interesting. And it's where the Mutter Museum is, if you've ever been to the, I'm probably mispronouncing it, Mutter Museum. So anyway, that should be interesting.
Just to clarify, what kind of abstracts would they be looking for in particular?
They're open to whatever.
So would medical topics, community topics?
Yep. Yes, yes, yes.
Okay.
They want to make it, they're really would like to make it more of an event than it has been, so they're really trying to publicize it. Just things of relevance to the community in some way, which probably everything you do is, so.
Amy, how many people usually attend that? Do you know?
I haven't been to it before. I mean, I'm going to put in as, being on the receiving end of this, I'm going to put in an abstract. So I don't know. I don't know how many. Amy, you've been?
Yeah, so last year was the first year they did it, and I went. I had an abstract and I presented. There was about 40 people there. It's in the dead of winter, if I remember. No, when is it? Early spring. It was maybe more in the winter last year. I remember it was still very cold and we had a rough winter, and it was early in the morning, so the attendance wasn't that great. But I think they're trying to vamp it up this year.
Thank you. Is there any public participation? I don't know who the other people are here, but do you have anything that you wanted to participate about? No? Mr. Nagel, is there anything special from your end?
Well, I just wanted to thank you, Amy, for your leadership this year and also for your service to the board, also Len. And I'll send an email to Dr. Saldivar. Putting a lot of time with us. I would remind you, we have many other boards in the community that you could probably serve on too. When we find good volunteers, we'd like to latch on to them. The only other thing I wanted to mention is tonight at our meeting, we will be giving a certificate of recognition to the birthing center in Bryn Mawr. They had their 10,000th birth last week. So we're going to recognize them for that. And that's it.
Thank you. So, Dr. Donato and I will be going off the board. So the rest of you in January, you'll be selecting a new chair and vice chair, so you could think about if you're interested in serving, as well as at that meeting, you'll be talking about what you want to be doing for the coming year. I think, I've been interested in trying to think about what we want at these meetings and trying to put things on the agenda and think about topics that need to be addressed, as well as showcasing, people are selected by the Board of Commissioners to be on this board for a reason. And so I think it's nice to share things about your own background. So I would just encourage you to think, to continue to think about projects that you would either like to see addressed or that you could help address. And I was talking with Dr. Fitzpatrick before the meeting started. I think she has a number of, student projects and faculty projects that are of great interest and importance to the community. And I think as well, it's nice to give students the opportunity to present here. For many of them, I know for one of the people coming on to the board, Kathy Durr, whose background is in laboratories, which I think will be a great asset. Her daughter, Kelsey Durr, was who presented in the summer from the Parks and Rec program. She was doing her internship there, and I know for her it was a terrific experience. She had never presented to kind of a non-student group, and she did a great job talking about Parks and Rec opportunities in the summer that were available for the township residents. So good luck, everybody. Thank you so much. I mean, I feel like everybody has really contributed a lot and stepped up to do things, so I really appreciate all of that. And again, we're so very fortunate to have Larry Teltone. He just does an outstanding job and has every certification possible, and then some. So thank you. So thank you all. So I think any further announcements?
One quick announcement, too, to keep the praise going. Amy, thank you for your service on the board, as the Board of Health, your service as president, and then also last year as, or 2 years for vice chairman, correct? And everything you did for the board, just excellent. There was a certificate here for you, of course, from the township. Thank you so much. It's obviously going to be tough to fill your shoes, and we thank you.
You have a certificate that I signed too. I'm not sure where it is. I mean, I signed it, like a couple of weeks ago. So I think, Larry, do you have Dr. Donato's certificate? Yeah. Oh, okay. All right.
No worries.
Well,
But I'll get it to Don. I apologize.
yeah. Suitable for
Deeply.
framing.
I really appreciate working with everybody here and in the past. I mean, everybody has been wonderful. I've learned so much being on the board and really have enjoyed working with all the different disciplines that are here, and everybody has just been great. So I really appreciate it, and it's always great working with you, Larry. And one of the members of the audience today is Dr. Joan, who's going to be the veterinarian on the board at this point. So you will enjoy her insight as well.
Yeah, I think certainly having a veterinarian be part of the board is so important. So thank you for your service and welcome for your upcoming service. Great. And we're right on time, which I was warned so many times is important tonight. So with that, I adjourn the meeting.